What's up, guys? So at this moment, we are going to talk about multiple myeloma. So this project is going to show our group's presentation about multiple myeloma. So to start with, let me show you some pictures of how multiple myeloma looks like. Here it is. It's an example of a multiple myeloma in the esophagus. So multiple myeloma is a hematologic cancer of the blood that develops in the bone marrow, the soft, spongy center of most bones. Myeloma typically occurs in bone marrow with the most activity, which is the marrow in the spine, pelvic, ribs, and area of the shoulders and hips. Many blood cells are produced in the bone marrow. Myeloma affects plasma cells, cells that produce immunoglobulins or the antibodies that help fight infection and disease. In multiple myeloma, normal plasma cells transform into malignant myeloma. Affects plasma cells, cells that produce immunoglobulins or the antibodies that help fight infection and disease. In multiple myeloma, normal plasma cells transform into malignant myeloma cells and produce large quantities of an abnormal immunoglobulin called monoclonal. The malignant cells also crowd out and inhibit the production of normal blood cells and antibodies in the bone marrow. Although the exact cause isn't known, doctors don't know that multiple myeloma begins with one abnormal plasma cell in your bone marrow, the soft, bland, producing tissue that fills in the center of most of your bones. This abnormal cell then starts to multiply. Because abnormal cancerous cells don't mature and then die as normal cells do, they accumulate, eventually overwhelming the production of healthy cells. In healthy cells, bone marrow, less than 5% of the cells are plasma cells. But in people with multiple myeloma, more than 10% of the cells may be plasma cells. Because myeloma cells may circulate in low numbers in your blood, they cannot populate bone marrow in other parts of your body, even far from where they began. That's why the disease is called multiple. That's why the disease is called multiple myeloma. More than 10% of the cells may be plasma cells.
Risk factors. Here are the risk factors of causing multiple myeloma. The age, genetic inheritance, obesity, diet, HIV or AIDS, certain occupations, exposures to certain chemicals and products, radiation exposures, some autoimmune disorders, and history of monoclonal gammopathy or MGUS. Okay, the first, age. 96% of cases are diagnosed in people over 45 years of age and 75% are diagnosed in people over 70 years of age. As we all know, if we got older, our immune system got lower. So we're very prone to acquire these diseases. Then, genetic inheritance. People who have a close relative within multiple myeloma have a higher risk of developing it. For example, if your family or your mother or your father have this kind of disease, there's a high risk of getting this disease also. Then, obesity. It's a high risk factor for many cancer, including multiple myeloma. Diet. Some studies have indicated that a diet low in fish and green vegetables may be linked to higher multiple myeloma risk. Certain occupations. People who work in agriculture, the leather industries, cosmetology, and petroleum workers have a higher incidence of multiple myeloma compared to the rest of the population. Exposure to certain chemicals and products. People who have been exposed to heavy metals, some hair dyes, plastics, various dust, including wood dust, asbestos, herbicides, insecticides, petroleum products, have a higher risk of developing multiple myeloma. Radiation exposure. Survivors of Hiroshima and Nagasaki atomic bomb explosions have a significantly higher incidence of multiple myeloma. And some autoimmune disorders such as rheumatoid arthritis. And MGUS, 1% of people with MGUS in the USA develop multiple myeloma each year. MGUS, like multiple myeloma, has the hallmark M proteins, which are produced by abnormal plasma cells in the blood. However, MGUS, there is no damage in the body. Next. Signs and symptoms. Signs and symptoms of
Signs and symptoms of multiple myeloma have symptoms experienced at the time of their diagnosis. The most common of these is back pain, which is more persistent and more severe than the ordinary back pain. Some of these symptoms which may affect people myeloma can cause on a damage on tissue and organs. This damage is caused by the paraproteins or by myeloma cells in the marrow. The order to be remembered is the acronym means CRAB, which means a high level of calcium in your blood. Renal failure caused by the paraproteins that cause damage to the kidney. Anemia caused by myeloma cells in the bone marrow. And bone damage related symptoms caused by bone pain and bone damage shown on x-rays. A high level of calcium in your blood is can occur when calcium form affected bone appears in your blood. High calcium level cause excessive thirst, nausea, constipation, loss of appetite, and confusion. Kidney renal failure, high level of certain types of abnormal monoclonal proteins, which are called light chains or Bench-Jones protein, damage the kidney. Anemia-related fatigue. This fatigue occurs as myomal cells replace oxygen-carrying red blood cells in your bone marrow. Bone damage and fractures. The type of bone damage in multiple myeloma is referred to osteolytic or lytic and appear as a punched-out spots on x-rays. Bone marrow is a common symptom. Damage and fractures. The type of bone damage in multiple myeloma is referred to as osteolytic or lytic and appear as a punched-out spot on x-rays. Bone pains, common symptoms, particularly in your back, pelvis, ribs, or skull.
Diagnosis of multiple myeloma is often made incidentally during routine blood tests for other conditions. For example, the existence of anemia and a high serum protein may suggest further testing. If myeloma is suspected, a specialist experienced in treating myeloma should be consulted to further evaluate the disease and help develop a treatment plan. The MMRF can help you locate a National Cancer Institute or NCI, designated cancer center, or a myeloma specialist in your area. Patients must commonly see a hematologist, oncologist, hematologist specialized in blood disease and disorder, and medical oncologists treat cancer using chemotherapy. Patients may also consult with a radiation oncologist, a doctor who treats cancer using radiation therapy. Criteria for diagnosis is difficult to make on the basis of any single laboratory test result. Accurate diagnosis generally result from consideration of a number of factors, including physical evaluation, patient history, symptoms, and lab result. A number of laboratory tests and medical procedures are used to help confirm a diagnosis of myeloma. These tests should be conducted on all patients as part of any initial evaluation. It is very important for patients to undergo all appropriate tests, as these tests help physicians determine treatment options. Many of these tests are also used to assess the extent of disease and plan to monitor treatment. There are criteria for diagnosing a multiple myeloma disease. A major criteria, a biopsy-proven plasmacytoma. Second is a bone marrow sample showing 30% of plasma cells. And the third is elevated monoclonal immunoglobulin levels in the blood or urine. Biopsy tests that examine blood, bone marrow, and urine detect the multiple myeloma. Ang minor criteria, a bone marrow sample showing 10% to 30% plasma cells, minor monoclonal immunoglobulin levels in blood or urine. imaging studies revealing holes in bones due to tumor or growth, antibody levels not produced by the cancer cells in the blood are abnormally low.
The pathophysiology of multiple myeloma. Plasma cells are mature forms of lymphocytes, a subclass white blood cells responsible for providing the antibody component of the immune system. Plasma cells actively produce antibodies against certain pathogens. These cells, like all blood cells, are produced in the bone marrow. So we have a video here that will explain furthermore about how multiple myeloma attacks the human body. So it is. Let's watch this.
This video is on multiple myeloma. I'll talk about what it is and how it relates to leukemia. We'll be putting multiple myeloma onto the same classification chart as I introduced in my video Leukemia and Lymphoma. I'd recommend watching that video first. Multiple myeloma is a type of cancer that develops in the bone marrow. Leukemias also develop in the bone marrow, while lymphomas almost always do not. Let's draw that part of the chart and put multiple myeloma as a cancer that develops in the bone marrow. We'll add more to this chart in just a minute. First, a bit more on multiple myeloma itself. It's unique in that it's the only cancer type to develop from plasma cells. Plasma cells normally produce antibodies to combat infection, and plasma cells themselves develop from B cells in response to infection. B cells are a type of lymphocyte in lymph nodes and other lymphatic tissue. B cells develop from lymphoid stem cells in the bone marrow before they move to lymphatic tissue. Thus, multiple myeloma is similar to lymphoid leukemias in that it develops from a lymphoid cell. Let's add that to our chart. Multiple myeloma can thus arise when there is a mutation in a lymphoid stem cell that causes that cell to mature all the way to being plasma cells without ever leaving the bone marrow and without needing an infection to fight. The cancerous plasma cells in multiple myeloma are thus mature. In the world of leukemia, cancers in which the cancerous cells can mature are called chronic. Those in which the cancerous cells can't mature are called acute. Multiple myeloma, since it involves cells that mature, is thus similar to chronic leukemias. However, multiple myeloma is a different entity. It's not actually considered a type of leukemia. The reason why multiple myeloma is in a category of its own is that, unlike the cancerous cells in leukemias, cancerous plasma cells are much more trapped inside of the bone marrow. Almost all cancer cells in multiple myeloma stay inside the bone marrow, so the cancer cells can almost never be detected in the blood. In contrast, in leukemia, enough cancer cells usually escape into the blood to be detected in the blood. The cancerous plasma cells in multiple myeloma may be particularly well trapped in the bone marrow because cells don't usually mature into plasma cells until they're already outside of the bone marrow. Thus, plasma cells haven't needed to develop a way of getting out. Symptoms of multiple myeloma are thus related to cancer cells taking up space inside the bone marrow and preventing the production of normal blood cells. These symptoms include anemia, susceptibility to infection, bleeding, and bruising. However, multiple myeloma is distinct in that the cancerous plasma cells tend to eat into the bone around them, causing bones to break more easily. Eating away at bone also releases into blood the chemicals the bone was made of, including calcium. Increased calcium in the blood can cause additional symptoms. Multiple myeloma is also unique in that it produces antibodies. I've mentioned plasma cells normally make antibodies, which are proteins that stick specifically to parts of invading organisms. Cancerous plasma cells still make antibodies. In fact, they can make very large amounts of a single type of antibody. These antibodies, called IgM or IgG, can be detected by a lab test called serum protein electrophoresis and can get stuck in your kidneys. Since kidneys remove waste from the blood and allow that waste to be excreted as part of urine, kidney problems can affect urine production and the removal of waste from the body. Most other blood cancers do not produce antibodies, so don't have these complications. Hopefully this has helped multiple myeloma to make a bit more sense. I also have a video on myeloproliferative disorders and myelodysplastic syndromes if you're interested in how those relate to leukemias.
So the main treatments for multiple myeloma are the chemotherapy, steroids, and biological therapies. Radiotherapy is also used to help control the pain. You may also have bisphosphonates to help prevent bone damage and relieve the pain. If you are fit enough, your specialist may suggest intensive treatment, dose chemotherapy with a bone marrow or a stem cell transplant.
Prevention. Multiple myeloma cannot be prevented. Healthy lifestyle choices such as eating a low-fat, well-balanced diet, exercising regularly, not smoking can help lower the risk for many types of cancer, including multiple myeloma. Avoiding exposure to chemicals such as metal, rubber, treated wood, and pesticides. And also avoiding exposure to viruses, examples, hepatitis and HIV, that are associated with an increased risk for the disease, and exposure to radiation can also reduce the multiple myeloma risk.
Watching, and we are the Group 2!